Hello guys, so now we shall be discussing regarding the maxillary artery and its branches. Okay, so a topic of discussion would be regarding your maxillary artery. Right, so let me draw the skeletal picture, right, skeletal picture of the skull region from the lateral side. Okay, so that would be more easy for us while discussing this maxillary artery. Right. Now, one very important thing I want to mention over here. What is that important thing is that, so this part over here is your orbit. Okay. Now, all the way from the orbit, this is your pterygoid process. Right. All of you know that we have got the pterygoid process over here. Right. So, what I'm doing is that I'm just cutting the part of the pterygoid process so that it would be easy for me to explain the structures over here. And this is your skull like this. Okay. So let me little bit enlarge this pterygoid process so that it would be easy. Right. So here let us see what are the structures. Before we look at the structures, first of all we have to write down what are the different kinds of openings which you have over here. Okay. For example, here you have got an opening, and this particular opening over here is called as your foramen ovale. This is called as your foramen ovale. Okay. Just behind the foramen ovale, here you have got another opening, and this particular opening is called as foramen spinosum. This is called as your foramen spinosum. Next, behind your foramen spinosum, you have got another opening here, a fissure-like opening. So this fissure-like opening which you can see over here is called as a pterygotympanic fissure. So this fissure-like opening is called as your pterygotympanic fissure. Okay, this is called as your pterygotympanic fissure. Next, you see an opening in the lower part of your eyeball here. This is called as infra. Anything which is lower is called infra. This is called as infraorbital foramen. This is called as infraorbital foramen. Infraorbital foramen. Okay. Next, after this infraorbital foramen, exactly here there is one more foramen, and this foramen over here is called as your spinopalatine foramen. Spinopalatine foramen. So what are the two foramens? One is called as the infraorbital foramen, and this one over here is called as your spinopalatine foramen over here. Next, within the mandible, you have got an opening like this. You have got a foramen here. This foramen is called as your mandibular foramen. Mandibular foramen. And this mandibular foramen is in continuous with a canal like this. Okay, this mandibular foramen is in continuous with a canal, and this canal over here is called as your mental canal or mental foramen. This is called as mental foramen, and the canal that is present between your mandibular foramen and the mental foramen, this long canal is called as a mandibular canal. Okay, so let us write down all the branches right now. Maxillary artery is divided into three important parts. So we have got three different kinds of branches. Let us see what are these branches. So first of all, you know that this artery over here is called as your external carotid artery. What is this artery over here? This is called as your external carotid artery. Now from this external carotid artery, you see the branches that are coming out. Let us say this branch is your maxillary artery, right? There are different branches of the maxillary artery. So from this, you see an artery that is entering inside like this and coming out of this pterygotympanic fissure. This artery enters deep inside your auricular regions. That is why you call this artery as deep auricular artery. Let me name this artery as 1. Okay, artery number 1 is called as your deep auricular artery. Deep auricular artery over here. Okay, now after this deep auricular artery, you have got the second branch. Look at the second branch now. See, this is a second branch that is passing just in front of this deep auricular artery. So this artery which is passing in front of the deep auricular artery is called as, in front is anterior, so anterior tympanic artery. So this particular artery is called as anterior tympanic artery. Artery number 2 is anterior tympanic artery. Okay. After this anterior tympanic artery, over here you see one more artery. Okay. So where is this artery exactly passing? See, this is the artery that is passing into this foramen spinosum and coming out like this. So this artery which is entering into this foramen spinosum is what is called as your meningeal artery. So artery number 3 is called as your meningeal artery. Artery number 3 is called as meningeal artery. Okay. Now after this meningeal artery, we have got another artery that is called as accessory meningeal. Meningeal is one branch. Next, in front of meningeal, we have got another branch called as accessory meningeal artery. For example, you see this particular artery. This particular artery is passing through foramen ovale like this, you see. So this artery over here is artery number 4, and this artery is called as your accessory meningeal artery. Accessory meningeal artery. So one is called as your meningeal artery and the other one is called as your accessory meningeal artery. Now after this meningeal and accessory meningeal artery, we have got one branch. You see, we have got one branch that is coming all the way down into the mandible here and supplying your inferior alveoli. Inferior alveoli in the sense inferior teeth like this, right? So the teeth that are attached to the mandible, these are called as inferior alveoli. So this artery over here is called as inferior alveolar artery. What is this artery? Artery number 5. Okay, let me write it as artery number 5. So artery number 5 is called as your inferior alveolar artery. Okay. Now what will happen with this inferior alveolar artery? This inferior alveolar artery enters into a foramen called as mandibular foramen. After entering inside, this will pass within this mandibular canal, and once it passes out of the mandibular canal, it means once it comes out of your mental foramen, this artery now it is called as mental artery. What will be the name of this artery now? This is called as your mental artery. Okay. Next important thing is that this mandibular foramen is having this artery, this inferior alveolar artery. From this inferior alveolar artery, you see small branches that are supplying here. These small branches which are supplying over here are called as your dental arteries. What are these branches? These are called as your dental branches. Dental branches of what? Dental branches of inferior alveolar artery. Now here itself, this inferior alveolar artery gives out one branch that supplies down to the mandible. Down to the mandible we have got a muscle called as mylohyoid muscle. So this is an artery that is supplied to your mylohyoid muscle. So you call it as mylohyoid artery. This artery over here is called as your mylohyoid artery. Done. So till here whatever I have discussed is called as a first part of your maxillary artery. Now after this first part of your maxillary artery, we have got the next part that is starting. See, from here you see one more branch. This branch is coming down all the way. Okay. So what is the name of this branch? This branch is exactly supplying to the muscle. See, here we have got a muscle like this, right? That is responsible for the chewing. What is that? Masseter muscle. So this is a branch that is supplying to the masseter muscle. So you need to call this artery as a masseter artery. So what I will do is that I will write it as artery number 7. Okay. This artery number 7 is called as your masseter artery. Artery number 7 is called as your masseter artery. Now after this what is going to happen? It will come all the way like this, and you know this process is your pterygoid process. See, what is this process called? See, this process is called as the pterygoid bone here. This bone over here is called as your pterygoid bone, right? So this is a pterygoid bone. This pterygoid bone is having two arteries. One artery passing laterally called as lateral pterygoid, one artery passing medially called as medial pterygoid. Okay. So there are two branches over here. one artery is passing laterally like this, so lateral pterygoid, and another branch is medially passing, so medial pterygoid. So this is your artery number 8 and 9. What is artery number 8 and 9? One is called as a lateral pterygoid artery, another one is called as a medial pterygoid artery. So artery number 8 and 9. Lateral pterygoid artery, and the other one is your medial pterygoid artery. Medial pterygoid artery. So two arteries, lateral pterygoid as well as the medial pterygoid artery. Now after this lateral and medial pterygoid, you have got one more artery that comes down like this and supplies to your buccal region. So you call this artery as buccal artery. Artery number 10. Artery number 10 is called as your buccal artery. This is called as your buccal artery. Okay, so artery number 10 is called as your buccal artery. Now after this buccal artery is done, we have got another important artery. We have got another important artery that goes all the way, supplies to your temporal region. This is called as a deep temporal artery. What is this? Deep temporal artery. Here itself I am writing it. This is your deep. Okay, let me number it. Okay, why to disturb all these things over here again? Artery number 11, that is your deep temporal artery. Okay, now after deep temporal artery, till here whatever branches I have so far discussed is the second part of your maxillary artery. Right, now after this second part, coming on to the third part of the maxillary artery. This third part gives one branch down all the way. Right, this branch over here you call it as descending palatine artery. What is this artery? Descending palatine. The number I should give is 12. So this artery number 12 is your descending palatine artery. Descending palatine artery. Okay, now after this descending palatine artery, the next artery. Now this artery comes all the way down and supplies to the alveoli here. So it is supplying to the alveoli on the top or on the bottom? It is supplying to the alveoli on the top. On the top also it is supplying to the anterior alveoli or the posterior alveoli. These are called as your posterior alveoli. So you have to call them as posterior superior alveolar artery. Artery number 13. Okay, artery number 13 is posterior superior alveolar artery. This is your posterior superior alveolar artery. Next important artery is, you see this particular branch that is coming and entering into your spinopalatine foramen, right? And this artery comes out like this. So this particular artery is your artery number 14, and this is called as spinopalatine artery. Spinopalatine artery. Okay, next important branch is that you see another branch that is coming all the way down and entering and coming out through this infraorbital foramen, right? So this artery which is coming out through this infraorbital foramen is called as infraorbital artery. Artery number 15. Artery number 15 is your infraorbital artery. Infraorbital artery. Okay, artery number 15 is your infraorbital artery. Next, you have got last two important arteries. See, one artery which is going up, this is called as pharyngeal artery. Next, another artery that is going up, this is called as artery to pterygoid canal. So that, let us write it as 16 and 17. What are those 16 and 17 arteries? One is called as the pharyngeal artery, and artery number 17 is artery to the pterygoid canal. Artery to the pterygoid canal. So these are the 17 arteries which you can see over here. So all the arteries whatever I have drawn over here, let me just sum it up. This red color thing, the arteries which you can see with the red sketch, arteries which you can see with the pink, and the arteries which you can see with the green. So arteries which you can see over here are called as the first part of the maxillary artery. The second one is called as the second part of the maxillary artery, and the last one is called as the third part of the maxillary artery. So these are the three parts of the maxillary artery which you need to know. So what are the branches over here? First part branches, these are the branches on the first part. Okay, so from 7 we have got the second part, right? So these are the branches of the first part of axillary artery. Next, after that, the second part, right? The second part is still 11. So these are the branches of the second part of your maxillary artery, and the rest is the third part of the maxillary artery. So these are the three parts of the maxillary artery which you need to know, guys. So thank you so much for watching my video. Goodbye.